Let's take a look at the effects of perimenopause on the mouth. Low estrogen causes changes in the amount and quality of our saliva. That can lead to a dry mouth. Saliva is needed for chewing, swallowing, talking, neutralizing the acids from food, and it flushes out all the microbes in the mouth. So a dry mouth can cause impaired taste, difficulty swallowing, pain, mucositis, and it disrupts the balance of oral microbes. With decreased saliva, the pH lowers in the mouth, which increases the risk for oral infections and cavities. Low estrogen causes the oral mucosa to thin, so you're more prone to inflammation and a loss of connective tissue around a tooth. Due to dry mouth, some women also experience menopausal gingivostomatitis, which is usually seen as bleeding, shiny, red, dry gums. But because the oral mucosa has thinned, it's more prone to developing a bunch of other disorders. And burning mouth syndrome is a chronic complication in menopause. Let's look at what's happening below the gum line. Progesterone stimulates bone formation and bone turnover, while estrogen has an anti-inflammatory effect on the tooth supporting structure, and it regulates bone turnover so that our bones can remodel. Now, if menopausal women have plaque that contains periodontal bacteria, they seem to have an exaggerated response to that plaque, and it can't seem to balance the good and the bad bacteria. The low estrogen and progesterone stimulate bone breakdown, so that leads to increased bleeding and inflammation, and it decreases the density in the alveolar bone and the bone's height. So when you lose the surrounding structure of your teeth, it can cause mobile teeth and even tooth loss. But there are many risk factors for tooth loss in menopausal women. Smoking, diabetes, older age, having less than 20 teeth in your mouth before menopause, and so many more. So hormone changes in menopause are not the only cause for tooth loss, so risk assessment should be completed by a dental professional. As you can see, menopause can affect the mouth in so many ways, but we need to stress the importance of prevention. Having good oral home care with regular flossing, brushing, and rinsing, and visiting your dental office regularly for scalings and x-rays to monitor for that bone loss are very effective prevention strategies to preserve and protect your oral health before and during the menopause transition. And medical professionals should be aware of the oral changes that can happen during menopause to help minimize any pain and discomfort that you might be having.